Welcome to another Hi event right here on Hi TV, your luxury channel. I'm here at the Faculty of Medicine at the University of Colombo along with IIHS to participate in the WONCA conference for South Asia region for the year 2024. My name is Dima. Stay tuned with Hi events to find out more.
It's with great pleasure that I extend a very warm welcome to every one of you to this significant gathering, the Conference on Enhancing Primary Healthcare Nursing Practice, Innovations, Challenges and Best Practices, which is delivered as one of the pre-Congress sessions at the WONCA South Asian Region Conference 2024.
Main focus was somewhat related to what we are discussing today. Look at the community and home-based care. Currently, typically, this part of the world, nurses are in institutions. Maybe primary health care and the secondary tertiary, but to move out there, can they look at community and home care more and focus on more preventative health care, use of technology and nursing informatics, and holistic and patient-centered care. That was the focus of nursing now. Now, today's, now 2024, they have moved into, out of this and expanded it to Nursing Now Challenge. The young nurses who are there, please go to this website and get yourself registered. There are enormous amount of information you get every day, and then you also can share your things that you are doing at wherever you are with this particular focus of Nursing Now Challenge.
In the last 6 months, this is the fourth time I'm taking part in a conference in Sri Lanka. So, and that probably will be the trend in the future as well, because we ourselves as relatively young medical professionals have gained a lot from this country, and we are so eager to give back as much as we can. And I've been part of IIHS from 2011, and ever since we've done a lot of interesting work, exciting work, and most of them were around nursing and developing various capacities in nursing, which is something that I'm extremely passionate about, which is something that I enjoy even more when I'm practicing in a different setup now over in New South Wales, Australia as a GP. But my main interests are in health informatics and education, which is a part of this talk as well.
So my topic is something little kind of different aspect. This is how nurses can really use their knowledge and their opportunities for the nutrition promotion. So in that sense, first of all, I was really looking at nurses are really having a unique position to provide the nutritional promotional kind of setting and giving the nutritional promotional things for the patients, because you are always with patients. Especially even when we take it from the inward. Now, you are providing the diagnosis card for each and every patient. So that's another one opportunity you have to give a promotional thing. So at the same time in the OPD, you come across each and every patient come to the OPD, because even the registry or something and so that's another time that you have an opportunity to provide the promotion. So at the same time that your words carry a lot, because nursing profession has a lot of kind of influence to the patients, because they listen to you, they know, they talk to you. The patient likes to discuss their outcomes with you. So because that's a closest friend in the hospital is nurse for the patient.
I have Dr. Kitsiri Edrisinghe here with me. IIHS is the co-organizer for the WONCA Conference 2024 for the Southeast Asia region. Now, Doctor, let's talk about the significance of the IIHS participation and the organization with the WONCA Conference.
Hi, thank you. Good morning. The WONCA is the World Family Physicians Conference. So it's conducted every year. In different countries. Thankfully, they have selected Sri Lanka this time, and our participation is as a leader in healthcare training. So we are participating as a technical partner for a pre-Congress session on empowering nurses on enhancing their skill sets. The most important element here is that we as IIHS has been doing these technical conferences for the last almost 12 years. This is the 20th World Technical Conference that we are participating with a view to give back to the practicing professionals for the world knowledge to inculcate them in their day-to-day practice.
Well, sounds fantastic. And moving on with the day, what can we look forward to?
Well, we have an international panelist as well as the local professionals contributing to this valuable event. This primary healthcare is a very important area if you really look at the whole health system. Out of the total system, almost 60% are primary care health institutions. So as you know, Sri Lanka, almost more than 70% of the population lives in peripheries. What you and I see, only about 30% of the population covered by the health professionals. But this is important area to look after this primary healthcare network, because those people who are visiting these facilities are the ones, the productive population in this country. They add loads of contribution to our economy, so to making them healthy is the paramount important. In addition to this theme of this conference is to make sure empowering the nurses and the primary healthcare workers in order to support their day-to-day work. So we are concentrating on healthcare promotion, how they can prevent diseases before it happens. So currently we wait till the patients come to treat them. No, we have to really look at how can we prevent the diseases, make them a healthy life. So wellness is one part of it. In order to do that, we know in South Asia there's a massive gap between the different professionals. Like doctors are on the top of the pyramid and the rest are down. But unfortunately, this situation has come up over the years. It's time that the challenges are more in our health system. So what we have to do is to collaborate with different professionals, remove these hierarchical structures and give them more skill and power, or if I would say empower them in order to tackle day-to-day problems. So the doctors and the others can look after the more specialized work that they do. So therefore, this is one of the themes in this particular conference, and I hope the participants are mostly nursing professionals and future nursing professionals as well, some of the students. So therefore, they would take it back to their workplace and then improve the care given to the most vulnerable population of this country.
I have Dr. Nishant Silva here with me, who's already spoken and had his talk. But doctor, let's talk a little bit about the importance and the significance of your talk and using in technology and different softwares into practicing healthcare these days, and the overall importance of the WONCA conference as well.
Yeah. Thank you. So I live and work in Australia now, but I was working here as a GP in Sri Lanka. And I've been a part of WONCA for the last 8 years. Been a part of IHS, the organizers of this for, say, about 15 years. So, I mean, software is a very common thing that we use over there in Australia. Like that, I depend a lot on that. I've told few others that I would be blind without them, but it is extremely different over here. And health sector in Sri Lanka is great. There's no doubt about that, but very busy, working very tirelessly over here over years and years, and still the doctors here do that. A little bit of technology, which is not very expensive these days. A little bit of technology can improve that a lot, save you a lot of time, save you a lot of energy, and reduce that burden a lot. So that was the gist of most of this talk. Plus, it does a world of benefit to improve the quality of what we do for our patients. And for what you asked, so look, I mean, I'm here for this event, so that's partly by WONCA, partly by IHS. So people like me, people like the other speakers who will be talking later today, also already spoken, we come here and share all the stuff that are not here and try and show a different perspective. And to do better, isn't it? To improve things. So yeah, I mean, that's the importance of these sort of conferences where you...
I have with me Dr. Amal Harshad Silva here at the WONCA conference. Now, Doctor, let's talk about the significance of hosting the WONCA conference here in Sri Lanka and the importance and the significance of having conferences like this to improve our health practices here in Sri Lanka.
Yeah, WONCA is a great organization spread out the whole world, and all the general practitioners are involved with WONCA, and therefore WONCA is a huge organization, and we are very proud to have one of our Sri Lankans, Sri Ranjan, as the Asia president. Therefore, I think it's a very big deal for the country, and through WONCA conference and also IHS is also partnering with WONCA this time to enhance primary health care for nurses, because I think nurses' primary health care can change the whole scenario of healthcare in the world, and that's why I think all these people are getting together and improve the care given to the public at the grassroots levels. Whether it's UK, whether it's Australia, whether it's Sri Lanka, that needs improvement, and that can do a major change. Today, there are a lot of diseases which can be changed by changing the way we live our lives, and therefore nurses can change it in a better way than doctors.
I have Miss Ruth Bradley here with me. Now, Ruth, let's talk about the significance of having the WONCA conference. First of all, here in Sri Lanka, and overall having a conference like this to share your ideas and expertise with the crowd out here.
So, thank you. I am a director of nursing in community care in East London and also Bedfordshire in the UK. This conference has been about primary health care, and we have a lot of connection with primary health care. So as nurses, it's great to come along to this conference, hear more about the plans and aspirations for primary care in Sri Lanka and ways of working. And what's really come across today is the importance of the role of the nurse in driving prevention, management of disease in the community and primary care. So as a community nurse, we're seeing older people, an ageing population, many more chronic health conditions. So it's so important the nurse is able to have the clinical skills, the leadership, the capacity, and working in different ways so we can actually meet the health needs of our local population. And primary care, which we're hearing about at this conference, is really well positioned to do that. They're the first point of contact and access to healthcare services, working with their family doctor, working with nurses in the practices, so really able to reach out to the community. And what we're hearing today is about some of the approaches, nursing models, where we can reach people and really educate them to look after their own health. But what's really come across is the value of nursing, the importance of that role, the innovations they can create, and development of services, and really working in partnership with other healthcare professionals in primary care so they can pull that care together around the patient, their family and carers. So it's been a great opportunity today. I'm really thankful to be here. We've heard about some wonderful innovations that supports primary care.
It has been a day of information and engaging conversation here at the WONCA Conference 2024. Until we see you again with another high event, take care and be safe.